Following portion of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to meet your provider with ETSU Health, and today we have Dr. Jack Owens joining us here. And Doctor, thank you for taking some time with us today.
It's my pleasure.
Let's talk about your specialty, neonatology. Talk to us, what does that mean?
Well, neonatology is a subspecialty of pediatrics, just like cardiology is a subspecialty of internal medicine. So I did a pediatric residency after medical school and then did 3 years of a neonatology fellowship. That's where we learned how to take care of critically ill and preterm babies.
Dr. Owens says that working with babies and their families in a NICU situation is a very fulfilling part of his profession.
Well, yeah, we're privileged to be able to work with the babies. I get to work with the best nurses around in the NICU. Plus, you know, you're managing a family through a difficult time. Yeah. So sure, when we start off in this field, we're interested in the physiology and the intensive care. But as you evolve, you start to realize more and more that it's about the families and taking care of not just the baby in front of you, but the parents.
Dr. Owens recognizes that all of the successful outcomes for NICU children are the result of a lot of hard work by a lot of people.
Right, we're just part of the team.
Right.
It's a big team. It involves nurses, administrative leadership, speech therapists, lactation specialists, physical therapists, pharmacists. It's a complete team, and the way to achieve the best outcomes are to really function as a team.
Right.
You know, this is not an individual sport, it's a team sport.
And for Owens, having one of his 4 children spend time in a NICU gave him a whole new perspective on neonatal care.
My third child, my oldest son, spent 4 or 5 days in the NICU, was identified as having a heart defect. So this is getting kind of personal, but he had 2 rounds of heart surgery before he was the age of 1. So that actually was an eye-opening experience for me to experience the other end of the relationship, being the parent in the NICU. It did not help that I was a physician in the NICU. I probably knew more than I needed to, but it was eye-opening and it changed my perspective.
Away from the NICU, Dr. Owens enjoys the great outdoors with his family and playing his banjo.
I'm interested in hiking, camping. I play a little bit of banjo.
Nice.
I try not to play where anybody can hear me, but a little bit of guitar. The music tradition up here is awesome.
Right. Having Bristol here, birthplace of country music, I mean, you're synonymous with banjos and all that. It's got to be a perfect fit for you.
I've already got the membership, and I've already been 3 times, and I've been here in 3 months.
As Dr. Owens looks toward the future, his thoughts turn toward improving outcomes for his small patients and their families.
Part of the benefit of coming to East Tennessee State University and Niswonger Children's Hospital is the opportunity to do research.
Right.
I've been a clinician all my life, but I have a master's in public health degree that I got during my training, and I've tried to put that to use over the years, but here I have an opportunity to do research and focus more and more on quality improvement and looking at structures of quality that improve outcomes. You know, what is it that we need in a healthcare system that optimizes patient outcomes? How do we reduce variation in care and optimize outcomes?
All right, Dr. Jack Owens, thank you so much, sir.
Thank you.
Dr. Jack Owens, this week's Meet Your Provider with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.